Good morning, everyone. My name is Lynn Al Tayara, and I'm a young Gasteiner. And I'm happy to be here interviewing Jarno Habicht, head of the WHO Country Office for Ukraine. Jarno, I would like to start by asking you, what are some of the transformative changes that have been initiated in Ukraine before the pandemic and the war? And how have these changes contributed to the healthcare system resilience?
Thank you, and thank you for having me. And it's great to be in Gastein, because this year we talk about democracy, we talk about demography, and we talk about digital. And the war since Russian Federation invasion on 24th of February 2022 has put in test all of them. But we see that Ukraine has passed some of the tests because these transformative changes that were there before. Ukraine has been investing into primary health care. Ukraine has ensured that there are more modern ways of health financing in place, including the institutions that have been set up since 2016. Ukraine, at the time of war, has adopted the new regulation of public health. So transformation is not only happening before pandemics or war, transformation also can happen during the war.
That's really admirable to hear from Ukraine's end. And what are some of the challenges that the health system is currently facing, and how has WHO played a role in addressing these challenges?
Thank you. War puts every health system, any health system in the world, into the test, and there is disruption. We have seen huge population movement. Currently, we have 3.5 million people displaced within Ukraine. We have more than 7 million outside of Ukraine. We have seen with that movement also healthcare workers moving. We have seen attacks on health. We have recorded more than 2,000 attacks on health. But in that environment where you have constant shelling, attacks on health, the health services are provided. The children are born in the hospitals. The elderly are having their access to primary health care. The pharmacies are open, or new ways to ensure access to medicines, including the mobile pharmacies, are there. As well, the humanitarian community has been supporting, especially in the areas closer to the front line, where in 2024, 3.8 million people need to be reached. And WHO has been playing a part of that, ensuring that there is a coordination, ensuring that our team is there available. We have more than 300 people across all Ukraine, and to ensure that also we keep the reform agenda moving. So our task has been in the last 2.5 years to ensure that at the same time we work on response, recovery, and the reform agenda. And this is what WHO is doing.
And it shows the importance of collaboration in these tough times and challenges to address the situation. And just in terms of key takeaway messages, what can policymakers learn from the Ukrainian experience when it comes to preparedness plans, early recovery, and response?
The lessons are still to be recorded as well, because the war goes on. But what can be learned, and we discussed here in Gastein as well, is early recovery is very important, because early recovery is allowing people to go back. We heard this from the minister, Viktor Lyashko. We heard it yesterday from the governor of Zaporozhye, Ivan Fedorov, that in spite of constant shelling, in spite of all the attacks, you need to ensure that the services are available, the services are restored, because that creates the trust to the health system. There are many lessons to learn, so our interview is too short for that. But I think what is important is when the war goes on and you need to respond, you need to keep the health system functioning. And we have been discussing a lot about health system here in Gastein. Actually, the ways how health system is financed, the ways how primary care is arranged, the ways how hospitals functions, how the patient pathways are arranged, plays also a very important role in the humanitarian setting.
And I would just like to say, to end this interview by saying that also a lesson learned, that the Ukrainian people have truly expressed resilience and courage that's just very admirable. And the fact that they're still focused on the future, on rebuilding, is a lesson for all countries in these tough times.
Exactly. Thank you.
Thank you very much, Jarno, for being available.
Thank you.